many of you know, Luke Schaefer and I published $2 a day. Woo, it's got a life of its own. In September, documenting the rise of the number of families with children living on virtually no cash income since 1996. And I want to tell you a story that's behind the book because we didn't go looking for this. Some of you know that when I was a youngster in the early 1990s, my dissertation advisor, who shall not be named, convinced me to go running around the country for many years, collecting the budgets of poor single mothers, many of whom were on the AFDC program. So Laura Lane and I, my partner in crime on that book, did so and published Making Ends Meet. I then went on to study other things, the family. I wrote with Jan Sykes and other co-authors a book on the full-time, full-year, working poor. And so it wasn't until 2010 that I found myself looking at a group of young people who were kind of in the category that I had been looking at way back in the early 1990s. I was in Baltimore for the summer, interviewing the young adults of the Moving to Opportunity experiment, a very disadvantaged group. And one day I was going into the Latrobe homes on Madison Avenue. They're tucked right in the shadow of that decrepit prison that's about to close, to meet Ashley. Ashley had a baby that was just a couple of weeks old. And as I came into the house, the first thing I noticed is that Ashley was visibly unkempt. She looked depressed. She had a really flat expression on her face. She was also having a hard time supporting her baby's head as she rocked her, which is, any mother knows that's a bad sign. There was only one chair in the house. There was virtually no furniture, and Ashley sat on that chair, and I sat on the floor interviewing her, and this perch gave me a perfect view into the cabinets, which of course had no doors, and I could see there was nothing in them. So immediately I went into Making Ends Meet mode and began interviewing her about her budget. Don't tell the IRB. But lo and behold, I discovered that Ashley had no TANF. She was not getting food stamps at the time, nor had she yet enrolled in WIC. No one in the household was employed, so the sole benefit this family had beside Medicaid was this housing subsidy. So this is what first gave me the thought that perhaps in the shadow of welfare reform, under our noses, a new kind of poverty had arisen in America, a kind of cashless poverty, a poverty that was so deep that we didn't even think it was out there, so we weren't even looking to see whether it existed. I kind of put that thought in my back pocket, and the next day I came back to our research team. I wasn't actually with them. I came back to visit Ashley. And we had kind of said to her, gee, Ashley, we got a few more questions to ask you. I think we can give you another stipend, if we can come back the next day. As you know, qualitative researchers are mandated reporters. We didn't want to report her, but we just wanted to make sure she and the baby were okay. So when we arrived the next day, of course, we had given her $50 the day before. And we were shocked to note that she met us at the door. She had gone and gotten a home perm. She had walked down Broadway Avenue to the Goodwill and gotten a pantsuit, which she was wearing. She had a smile on her face, a spring in her step. She had deposited the baby with her mother and was on her way out to look for a job. Okay, $50. So I thought to myself, I had been reading the work of Robert Moffat, and I knew that we had really shifted our safety net, right, from the bottom fifth to the second fifth, and from cash to in-kind resources. And it occurred to me, is there something in America's most advanced capitalist society about cash that is so fundamental that it really can't be the fungibility and so on, that it really can't be replaced by in-kind resources? And so when Luke arrived as a visiting professor at Harvard that fall, I immediately saw 4 letters above his head, like shining letters, SIPP, because I knew that he was one of the nation's experts on the SIPP. And it occurred to me that this might be the best data set to see if what I had seen in Ashley's home was indeed a thing. And so that is how our partnership began. And of course, these are the initial results we reported from the SIPP. As Bruce says, not perfect, but but the best, and certainly the best over time, because it doesn't suffer as much from declining rates of participation in the study. We see a growth of from about 600,000 households with children in 1996 to 1.5 million in 2011. The blue line treats in-kind benefits, SNAP, I believe in this chart, as cash. I've already told you why you might not want to do that. That cuts the estimate about in half, but it only looks good relative to the gold line. So yes, SNAP is important. We should fight for it, but no, it doesn't eliminate $2 a day poverty. And again, you might not want to treat it like cash. Now, in subsequent analysis, which we've published both in the Social Service Review and in the new Russell Sage Journal, first issue on extreme deprivation, we take a look at the duration of these spells, right? And I should say that those snapshot estimates that we showed you earlier take into account the University of Madison problem, where people only get paid 9 or 10 months out of the year because they're wealthy university professors. It excludes anybody that has substantial assets, and I'm just kidding, meeting. I'm just kidding. I thought that would get him, and so on. So you know, we have been careful to tell a conservative story here. What we did in the next set of estimates is we followed children over time, because actually households are too unstable to follow over time because they're always shifting adults. And when we followed children over time in this analysis, we threw out any kid who had experienced less than a quarter of $2 a day poverty. And then we divide the rest of the kids into two groups, episodic, which is between 3 and 6 months, and then chronic, which is between 7 and 12 months during a calendar year. And what we can see is that since 1996, both groups have grown, but the biggest growth has been in the chronically extreme poor. So of course, you never want to stop with any data set. Bruce gives us a 101 on why that is. We wanted to look at whatever data we could to see if there were other indications that something was changing at the bottom, and where we had a growth in the number of households who were living a virtually cashless existence. So these are administrative data from SNAP. They're plotted against our estimates for those people in the SIPP that were receiving SNAP, and we see, you know, almost an eerie correspondence between these estimates. Luke likes to say when he finished this chart, he quit for the day and went out for coffee, because it never gets this good. But we do see a sharp correspondence. When Jane Waldfogel and Irv Garfinkel saw this chart, they pointed to sort of the branching off of the two estimates with, these are zero-income households in SNAP, right? And so SNAP, if you lie to SNAP about your income, you know, it's a felony, and it's a felony punishable by, technically by more years in prison than molesting a child. So it's a very serious felony, and families are warned not to lie about their income to SNAP. Probably some do, but in any case, we see this correspondence. And this taking off of the SNAP number at the very end of the series, according to Jane and Irv, might well be because fewer and fewer people are getting counted in the SIPP because there are more and more people living doubled up or homeless during this period. And by the way, the growth there is from 300,000 households with children to 1.3 million households with children. So as of 2004, we've required folks to report, schools to report the number of homeless students. And when I say homeless here, I'm referring to kids who don't have a regular place to live. So it could be kids doubled up, it could be kids living with grandparents, it could be kids living in homeless shelters. Based on our ethnographic work, we think all three of these forms of instability are very important. Most double-ups last, we know from the work of Hope Harvey at Harvard, last less than a year, and they tend to be very, very unstable. In our ethnographic work, we find that most of the adverse childhood experiences we record among our children occur in repeated perilous double-ups. And that first blip you see there, of course, is Hurricane Katrina. We need to have more audience participation here. But you see a monotonic rise. And again, this is in an unduplicated clients at food banks. But we thought that the real proof in the pudding that this really existed is whether we could go to 4 sites across the U.S. where the SIPP told us there might be concentrations of extreme poor, find people, talk to them, find out about their lives, and we did that, and that's really what $2 a day is about. It's about 8 families who lived under this condition, who we followed for a significant period of time. So I want to now do a little audience participation exercise to wake you up after lunch. This is something we've been doing with our undergraduates. And this is, again, getting at the idea of whether in-kind benefits are the same as cash. So pretend for a moment that you're a graduating senior at Stanford. And of course, because you're at Stanford, you've already been offered a job. You've been offered a job at X company, maybe Google, although the wages here are probably a little too low for Google, which offers you the following option. They'll give you $65,000 in salary or $62,000 plus $7,000 in food stamps. Which would you take? So anyone? Anyone want to vote? Pretend you're a graduating senior. How many people would take the deal, the SNAP deal? Okay, some of you. And why would you do that, Kristen?
I would spend money on food anyway.
You would spend money on food anyway. Okay? How about somebody who wouldn't take the deal? Yeah.
The stigma of going to the grocery store with your snack.
Okay, so you're going to, every grocery store teller knows whether somebody's paying with a credit card or an EBT card. So you might experience some stigma. For how many people did that run across their minds? Okay, quite a few of you. It turns out that undergraduates at the University of Michigan and Johns Hopkins University overwhelmingly reject the SNAP option for the cash option. And of course, if you jigger this different ways, you get higher and lower amounts. But in general, undergraduates want the fungibility of cash, even if they're going to lose total resources with SNAP. So the purpose of this exercise, of course, is to ask the question, is there something distinctive about cash in the world's most advanced capitalist society? Is it meaningful to be without cash in terms of both material well-being, but also dignity, right? You know, Ashley not only was better dressed, she was feeling differently about herself in terms of belonging, incorporation, and citizenship. Now, we know from the literature that America has mostly avoided poverty traps. But might this be one? And I offer 2 cases, Ray McCormick and Madonna Harris. Ray's from Cleveland, Madonna is from Chicago, who we've been following for many years. Both of them ended up falling into extreme poverty, and neither one of them has been able to escape over the years that we've been following them. So something to monitor for this very, very disadvantaged group that we might miss if we don't count the extreme poor separately from the deep poor or the just plain poor. Our interest in this has sort of morphed in 2 ways. David Grusky will talk about the National Poverty Center study a little bit later this afternoon. This initiative is really hoping to build on the National Poverty Center site in Baltimore and surrounding counties. We're working, Andy Cherlin and Robert Moffat and I are working with a team from the Harvard Medical School who knows a lot about measuring kids' development and brain activity. And what we'd like to do is sample off, in real time, off food stamp records so we can compare children who are extremely poor with children who are, and I know this is a terrible term, shallow poor, and then compare those to children in near poor households. And part of what we're trying to get at here is, you know, is health telling us something that other things are not? Is health telling us something different from income or from consumption? Now, in part, this is a validation exercise, okay? We want to see whether people are telling the SNAP program the truth, because that's a worthy question. We want to assess underreporting. We also want to measure the consumption of households, so we can explore the relationship between cash, in-kind resources, consumption, and child health and development. We want to employ a multi-county design. Maryland is rich but very unequal. And so Baltimore is one of America's poorest places. It ranks the bottom on Chetty's indices of upward mobility of the 100 largest counties. Montgomery County is one of the richest places in the U.S., and it ranks near the top of the mobility indices. And by also adding in Howard County and Baltimore County, we can explore the relationship between absolute poverty, relative poverty, and child health and development. And finally, we'll employ, if we get the money, a mixed method design that really allows us to explore these vital aspects of poverty that I've pointed to in both my talks: dignity, belonging, inclusion. So I will end there. Thank you.